Hello and welcome. Today we're going to discuss and explore the scope of practice laws for APRNs in the state of Missouri and what changes can unlock their full potential. In Missouri, APRNs are educated and certified to provide advanced nursing care. The state law requires that APRNs obtain a document of recognition from the state's Board of Nursing in order to practice within the advanced role and title. However, Missouri is classified as a restricted practice state, which just means that APRNs must enter into a written agreement or a collaboration practice agreement, also known as a CPA, with a physician, in which the APRN and physician establish delegations, protocols, arrangements for consultations, and referrals. And basically, under that agreement, physicians just must be 100% readily available and have a minimum percentage of charts they have to review over that APRN. They also have a percentage of cases of controlled substances that they have to review every 14 days, and there are limitations on how many APRNs a physician can collaborate with, and that's just under Missouri law. So, nurse practitioners are allowed, or APRNs are allowed in Missouri, to evaluate patients, diagnose, order and interpret diagnostics, manage treatment, and prescribe medications. Those are conditioned on that collaborative agreement with the physician and physician oversight. Um, Basically, in Missouri, APRNs are not allowed to practice independently, and the state of Missouri does not fully allow APRNs to practice to the full extent of their education and training without a physician collaborating or oversight. Um, there's also additional legal, regulatory, and federal barriers, um, including Medicare and Medicaid limitations. Even in other states with broader authority, APRNs are still regulated a little bit more tightly than physicians. Um, and then basically just removing barriers and um, achieving that full practice extent um, can be done through legislative reform, regulatory rule changes, federal insurance alignments, introducing and advocating for bills that amend laws to allow APRNs to practice independently after maybe a defined period of time or immediately when they are certified and competent. For instance, there's a bill currently proposing that APRNs with 2,000 documented hours no longer be required to hold a collaborative agreement. Um, we could do institutional practice changes, engage with hospital systems, clinics, payers, credentialing bodies to revise bylaws, contracts, and policies that require oversight by a physician beyond what the law mandates. Basically, in Missouri, APRNs are well educated, certified, and capable of delivering high quality care, but the state law still imposes collaborative supervision and oversight that prevent full independent practice. And there are additional barriers existing at institutional, federal, and reimbursement levels. Achieving full practice authority will require coordinated legislative reform, regulatory rule changes, institutional policy shifts, and coalition based advocacy. If done thoughtfully, this can increase access to care, especially in rural and underserved communities, while maintaining quality and controlling costs. I